Now, for decades, our public healthcare system has been the source of pride for Canadians. But the reality is the system is at a breaking point, and the ER is where many of our healthcare problems converge. If emergency rooms are the barometer of our healthcare system, then it's not hard to see why so many are calling this a crisis. In major cities right across the country, wait times can stretch for days. Meanwhile, in rural communities, ERs are closing for weeks, sometimes even months, and the effects can be devastating, even life-threatening.
She felt like she was dying in the waiting room outside, but she kept saying it more and more. She said, I feel like I'm dying, they're gonna let me die here, and I just told her, like, no, that's why I got you in the hospital.
But when it comes to fixing this crisis, well, there are plenty of challenges, including staffing shortages, lack of funding, caring for an aging population, important issues putting more pressure on an already overburdened system.
You're seeing a tidal wave of sweeping across this country right now.
It's an awful feeling. I mean, I've lived here all my life, and I've never seen it like this where you had your hospital closed.
And then the system itself got hit with COVID. Nearly 3 years of the pandemic has exposed and widened decades-old cracks, making them impossible now to ignore. Nurses are leaving the profession in droves, and at a time when ERs are seeing even more patients.
It's one patient after one patient after one patient after another. It's kind of hard for us to take a break for a moment to pause.
We need to start retaining our staff because we are losing them hand over fist, and we can't afford to do that anymore.
Canada's premiers argue that funding is what's needed. The Prime Minister wants to see more transparency and accountability. Others want to overhaul the system entirely, while some want more private options. But one thing is clear. Our emergency rooms are on life support, and the critical decisions that need to be made now will impact generations to come. Well, it's a similar story of feeling helpless for Jackie Bain when a call for an ambulance for her 92-year-old mother, Barbara Ross, was diverted from 911 to 811 in early February to ease the burden on emergency services. Then they spent another 24 hours at an emergency room to see a doctor. Jackie Bain says this badly managed transition put her mother, Barbara, at risk. And Jackie joins us now for more on this story. So, Jackie, thank you for making time for us. Can you describe what happened when your mom, Barbara, needed immediate medical attention?
I took her to the Devon Emergency, which is 20 minutes outside of Edmonton because it was the shorter wait time. We spent the entire day there. They put her on 5 mLs of fluids and sent her home with a test kit. And the Monday morning, I tried to call. There was no answer. Her facility went upstairs because they tried to call. There was no answer. Tried to wake her, had difficulty waking her. And I said, this is ridiculous. I came over. I tried to call 911. They immediately flipped me to 811. I went through everything, and they said, is she having problems breathing? Yes. Chest pains? Yes. They asked if her lips were blue. I said no. And finding out later, I guess that's the criteria. I said, everything is going through her completely. She's 92 and a half years old. She can barely walk, barely stand, hasn't eaten in days. I need help. I was desperate. And they said, take her to see her family doctor. I said, I physically cannot do this. How can I do this? What if she passes out in the car, has another episode in the car? They gave suggestions on how to set up my vehicle, suggested possibly calling a medical transport company. And after I hung up the phone, I helped my mother get dressed, took her to emergency. She sat in a chair, a metal chair, the entire day. The security guard came over, brought a blanket, said, can we prop her for her feet, help her lay down? The whole reason for me to call emergency is so she would at least be in a stretcher. I would have still stayed with her there all day. Her being in that chair took her other ailments back that much further.
Well, the woman that had to go through that entire ordeal is, of course, Barbara Ross, and she joins us now with her daughter, Jackie. Miss Ross, how are you feeling?
Well, I'm feeling a bit better now, but I'm still very weak because I've been in the hospital for 2 weeks, you know. And I just came out this morning.
You just came out this morning. Miss Ross, please tell us what it was like to call 911, to not be feeling very healthy, and yet people weren't giving you the immediate attention that you needed. How did that make you feel?
That made me feel very, very bad because it just shows what the healthcare system is now, you know. And I really felt very bad. I felt so weak I couldn't even stand up. And I couldn't believe they would turn me down, sending an ambulance for me, you know. So my daughter had to take me in her car to the hospital.
If you get sick again, God forbid, if you need to call 911 again, are you worried?
Yes, I am. And I'm very doubtful if I would call them because they would probably put me through the same scenario that they put me through before, you know, and which was very hurtful and deceiving. And I could not believe I have called an ambulance before, and they've always come and picked me up right away. Other people here, I'm in a senior's home, and other people here call them, you know, and they come and take them right away. And I couldn't understand with my condition why they would turn me down and tell me I didn't need an ambulance to go to my doctor. I would have had to sit down in my doctor's office for about at least a couple hours waiting, especially if I didn't have an appointment.
What has this ordeal been like for you and for your mom?
It's been horrible. It's the hospital care has been fantastic. They are run off their feet. It makes me worried what happens if we have to call again. The doctor, his final note said, if this does reoccur again, if it's minimal, yes, go see your GP. If it is how when she initially came in, he said to go to emergency. And I just kind of smiled and thought to myself, how do we do this for a 92-year-old?
Okay, well, Jackie Bain, Miss Barbara Ross, I thank you both so much for your time. I'm sorry that you two had to go through this ordeal, but it really helps give Canadians a glimpse of how challenging it can be when you call 911 for a loved one. Thank you both so much, and we wish you good health.
Thank you.
Thank you very much for having us.
Take care. Another story that gripped the country's attention was that of Charlene Snow. The 67-year-old Cape Breton woman had been waiting for over 7 hours to see a doctor. Her family says she died less than an hour after returning home from an overcrowded ER. Her daughter-in-law, Catherine Snow, says that death could have been preventable and is a result of our failing healthcare system. Catherine, thank you so much for joining us, and I want to convey our deepest condolences to you and your family.
Thank you so much, and thank you for having us to tell our story.
Well, tell me that story, please, Catherine. What happened to your mother-in-law, Charlene, when she got sick and she needed to go to ER?
So on December 30th, Charlene hadn't been feeling well for a few days leading up to the day that she passed. And she decided that she finally had to make her way to the regional emergency room. And she got there, was triaged, and proceeded to sit in a very full waiting room for approximately 7 hours. She felt she had jaw pain, and she had been feeling generally unwell, like flu-like symptoms. And she had, categorized her pain as about a 7 out of 10. And she sat in the waiting room, and when it became too uncomfortable for her to stay any longer, she asked one of the staff members how long it would be until she saw a doctor, and they told her that it would not likely be until the next morning. So she thought she would just try her luck at the walk-in clinic that we have here on the island. And she went home, and an hour later she left us.
What happened? Why did she die?
Her cause of death from the medical examiner was called a hemopericardium, which is fluid or blood buildup around the heart. And so essentially her heart just gave out when she got home.
If she had been assessed at ER and seen a doctor in ER, do you think she would have survived?
I think if she had the opportunity to speak to a doctor who could have asked her some more questions and got a bigger picture of the health issues that she was facing at that time, I think she may have had a fuller workup than she received, and they may have been able to catch what was happening to her.
You know, Catherine, as I said off the top, this story really gripped the country's attention because she did the right thing. She went to ER and she came home because it took so long, and then an hour later she's gone. And you shared this pain very publicly. Talk to me about what the response has been like to you sharing this story.
Well, I shared a post on my personal Facebook. About 6 or 7 hours after I posted it, I realized that this was much bigger than us. I've received hundreds of notes, thousands of shares on my post. And so a very good friend of mine traveled down in the middle of the night, basically, got to my home at midnight, and we worked until 4 a.m. on the website. There have been some changes since we told Charlene's story, and I hope that they will continue moving in a positive direction.
What changes?
They've implemented a couple of things to take pressure off emergency rooms. So there have been some respiratory clinics set up that take the pressure off of the ER waiting room and provide people a chance to go to these clinics when they would have issues that you would typically go to a family doctor for, which has taken the pressure off. They have people in the waiting room checking on patients, because oftentimes there aren't enough nurses staffing triage to be able to re-triage at the appropriate time according to the guidelines that they follow. So they do have people going throughout the waiting room and checking to make sure there are no worsening conditions and things like that. They're also implementing an opportunity for people to use virtual care directly in the waiting room, so that they may not have to wait to access to see a doctor in person. And soon they will have a room for just a nurse practitioner to pull in those cases that may need a dose of antibiotics or some casting or something like that. And soon that will be implemented at the Cape Breton Regional Hospital as well.
Catherine, I think your loss and your courage to share the story has resulted in some real meaningful change. And I want to thank you so much for making time for us, for sharing all of that with us.
Thank you, Natasha. We appreciate again that the continual telling of our story, I think, will keep us, as we say here, keep the foot on the gas, and hopefully we'll continue to see positive changes as time goes on.
Okay, you take care. Thank you.
Thank you so much.
For years, Canadian hospitals have grappled with a lack of staff and lengthy wait times for care. CBC News chief correspondent Adrian Arsenault got a first-hand look inside one hospital in rural Ontario.
It's 5 p.m. This tiny hospital in Chesley, Ontario is closing its emergency room for the night.
This is the wrong time to be learning this, to be showing up at the ER.
Yes. If it's urgent, then we call an ambulance for them, or they call an ambulance.
So they would get to the ER and then have to call an ambulance?
Yes.
To come here and take them to another hospital?
Yeah.
Have you ever had somebody show up really urgently and felt like, I kind of do need to treat them right here?
We did have, unfortunately, one episode where somebody did show up and needed care. There probably wasn't much that could be done for them, but the fact is, the family didn't know that the emergency was closed.
Yeah, they're both going to be scanned, no contrast.
I think it's a scary time to get sick. It's a scary time for us because we don't know what's going to happen. And it's a scary time to be a patient.
I should be sending them your way in a couple minutes.
Within these walls, there's a dedication that's the best anyone in trouble could ever hope for. But these helpers need help too.
And that's the key thing. The helpers need help. So we want to continue to take the temperature and get some more perspective from the very people who are working on the front lines in emergency departments. David Carr and Eric Haywood-Farmer are emergency room doctors, and Iram Chagala is an ER nurse. All three of them are part of our panel right now. Eric, I'll begin with you and ask you what it's like in your emergency room, because you have this situation where you're dealing with both urban and rural settings.
So yeah, I'm in the Kamloops Emergency Department. We're a pretty big trauma center in the interior of BC. We have a number of rural hospitals that feed into our hospital. Many of those are shut down for periods of time over the past year. We're also undergoing some renovations in our department, which makes our physical space smaller. So we have 26 stretchers in our department, and on average we have 30 patients admitted to the hospital in our department at any time. These are not emerge patients. These are patients that should be somewhere else in another ward. And then we physically have to run 200 patients a day through the space with all of those stretchers taken up. So it's a pretty overwhelming situation at times.
And what does that do to the quality of care?
The quality of care can be completely abysmal. You know, we've had patients who are in a stretcher after a stroke, and you have to lift them up and put them into a chair because someone's just had a cardiac arrest in the waiting room. We have patients that are admitted in our department for 4 to 5 days, and they spend 2 to 3 of those nights on a chair. It's really heartbreaking. And, you know, none of us got into this job to provide really bad care, but that's what we feel like we're providing much of the time.
Iram, let me turn to you, because as an ER doctor, you all will often see the patients before they get to a doctor at all. So as an ER nurse, what is that experience like, being so completely overwhelmed with so many people in that space?
It's actually quite frustrating and very stressful, because you could have patients that are very ill that require a resus bed, to be monitored highly. And if we don't have that available, then we have to try to make some sort of accommodation or arrangement for that patient, while there are other very gravely ill patients that are there in those beds. Not having enough bed space accommodations, having patients that have to be seen by a doctor urgently in the waiting room becomes very frustrating, very challenging, and very difficult for us to provide care, because what we're hoping is that we don't end up having a cardiac arrest or collapse in that waiting room.
You know, something that we don't often address is the kinds of individuals coming into the ER, not always people who have heart attacks or broken bones, Iram. Oftentimes they're people who might be homeless, might be dealing with a mental health disorder of some kind, some sort of substance abuse experience, and then sometimes you all have to deal with violence as you're trying to treat someone. Talk to us about that.
So this has been an ongoing issue in the emergency departments, where a lot of nursing staff and just staff in the ER have had to deal with verbal but also physical violence towards us. And I think that's also added to the challenge of trying to provide that care for patients and their families. It's as if they're literally biting the hand that's feeding them. So when we're trying to provide that care, when we're trying to accommodate for their needs and tailor to their needs and provide care for them or their family members, it becomes very challenging when they become violent, because all we want to do is just help.
David, let me turn to you now, because you said something really interesting when speaking to my producer that caught my attention. You said, we, being people who work in the ER, are victims of our own accessibility because ERs are open 24/7. What did you mean by that?
Well, our scope of practice has forced to be expanded. We know that 6 million Canadians and more than 2.2 million citizens of Ontario don't have a family doctor. And we're always open 24/7, 365. And I think all people in society know that, all specialists know that. And I don't blame patients. Patients need to advocate for themselves. I blame for our system that just doesn't have people that are able to take care of them. And as a result, it kind of dams up the emergency department so that we're not able to do the stuff we normally do. I trained in emergency medicine, but I provide a lot of primary care, and I understand that, but it's not necessarily the best place to see chronic complaints and primary care.
Talk to me about how COVID impacted emergency rooms, David.
Well, I think what has to be told is we had lots of problems before COVID. We just didn't politicize them, in that it wasn't something that the media picked up on. We've always had challenges. I think COVID exposed the cracks. What I think it's also amplified is burnout and mental health and major attrition amongst staff. So where in the past, when we had spikes in respiratory viruses and influenza every January or February, we had the staff to work. Now, because of illness and because of people just moving outside of this scope of practice, we just don't have the human power to look after the patients.
Iram, talk to me about that. The issue of attrition, the lack of nurses, even though anecdotally all of us know someone or are familiar with somebody who's come to this country, has been a nurse somewhere else, and yet are not able to work here. What's going on in that sphere?
So that's also adding on to the burden and pressure in the emergency department. When you don't have staff available to work, you have a high number of patients, and you don't have enough nurses working, well, then the quality of care becomes questionable. So, you know, you have a lot of patients that are getting sicker, those that have COVID, they may have other conditions, so there's a lot of care and monitoring that is required for these patients. But when you don't have enough nurses available, the quality of care becomes diminished. So it becomes very challenging. It's actually come to a point where they've asked a lot of staff to take overtime shifts, stay for extra hours, but there just isn't enough staff, and they're leaving the profession. So it's the idea of retaining nurses currently is becoming very, very difficult. You know, having a high turnover, nurses leaving because of the treatment that they receive in ERs, the fact of stress, burnout, mental health. The issues are ongoing. The list keeps going on and on.
Okay, guys, for the past 15, 20 minutes, we've heard about everything that isn't working. I want to shift this in our remaining couple of minutes and hear from each of you, because we've had so much discussion about the premiers and the money and the federal government. Beyond money, beyond extra funding, Iram, I'll begin with you. How do we fix the crisis in our healthcare systems?
Well, I mean, from a nursing perspective, I think we need to figure out how is it that we retain our current staff, because we need to figure out what is it that's driving nurses away. We need to figure out what actually drew them to the profession in the first place and what made them continue. But why did they drive away? Why did they leave? Why are they leaving? Because when you get when you're obtaining staff that is supposed to be replacing the current staff, that's just a Band-Aid solution or short-term fix for a long-term problem. So I think that's one thing that we need to try to understand.
David, final 30 seconds to you. Very difficult question. How do we solve this problem?
Yeah, I'm not a politician, but I've been around. I think we have to modernize our e-health so that we share data. I think we need a centralization of referrals so that there's a common referral pool. I think we need to repeal in Ontario Bill 124 to pay nurses. And I think we're going to have to invest in primary care and virtual care so that we can keep patients out of the emergency departments and let things run the way they're supposed to. Not an easy fix. And one last plug, I think we have to make it so that licensing in nursing and physician applies across the country, and we eliminate some of the barriers for foreign trained healthcare professionals.
Okay. David, Iram, Eric, thank you all so much for your time and for your insights.
Thank you.
Thanks for having us.